So you've had a cardiac event, and the question is what to expect when you next see the cardiologist at your follow-up appointment. Now, typically this occurs anywhere from 6 to 8 weeks after a visit to hospital for some sort of coronary event, whether it's been a stent or a bypass procedure or a heart attack where you were managed just with medications. Well, it's an important visit, and a lot needs to be accomplished sometimes in a short period of time, so it's important that you're prepared. But some of the things that we hope to achieve in that is number one, go over the event itself. What happened? Why did this happen? What actually happened? What did the doctors do? Because often in a hospital, you're shell-shocked, you're not ready to receive the information, and often when you get home and you have time to digest it, another explanation of the event is very worthwhile. We then want to know, importantly, how have you been doing? Have you been having chest pain? Are you short of breath? Are you dizzy? Are there problems related to the condition that you have that still exist? Or are there problems related to the medications that we've given you for the disease? And once we find out whether you've got problems or not, we try to address those. And importantly, we need to address your medications. It's really important that you bring in your medications if possible, and we can go through them one by one to make sure that you're on the appropriate therapy. And in many cases, we do need to adjust. Sometimes a little bit up, sometimes a little bit down, and sometimes we're able to get rid of medications. I know as most patients are keen to get rid of medications, but many of those medications will continue for a year and some of those for life. But it's important to know what medications you need to remain on and why we have them in place. We also like to assess how are you doing and we doing with risk factors. Are we controlling your blood pressure? Are we controlling your diabetes? How are we going with smoking cessation? How's the cholesterol going? How is the weight going? How's your diet going? And how is exercise going? All of those are important factors that can help decide whether your heart disease is going to come back or not. And if we control those risk factors really well together, you're certainly less likely to have a problem that ends up in hospital again. After we look at medications, we want to look at activity. What have you been doing? Are you walking? Are you pushing yourself? Are you back to gardening? Are you back to work? And in some cases, we need to pull the reins in because you're working a little bit too hard. And in some cases, you need a little nudge forward to get you going a little bit faster. So we want to assess your activity and find out whether you're at an appropriate level given what's happened to your heart. We also want to know, what's happening in your life. Are you ready to go back to work? Are you ready to go back to driving? And are there other things that you'd like to do that you're concerned about and might not want to do? Those are the questions that we try to answer in that visit because we want to get you back to as full of activity as possible. Lastly, I think we really want to know is what does the future kind of hold? What's going to happen? Are there things that could happen down the road? Things that you could need, either therapies or devices? And importantly, what is the planned follow-up? Some patients we're happy to see again in a year. Some patients will want to see sooner, in a couple of months. And it's important you go away from your visit knowing when are we supposed to come back and see us? How often is that scheduled? And also what other caregivers should be involved in that care, whether it be your family doctor, cardiac rehab people, or other health providers that are going to help with your heart disease. So that's what to expect with your visit, and we look forward to seeing you there.